Welcome back to another episode of Daruma Dojo Dialogues. I am here with Dr. Alexander Greene,
Hello.
aka Ito.
Hey, welcome.
How are you doing?
Oh,
my
doing
pleasure.
well.
My pleasure. Of course. Glad you're doing well. I'm doing well also. Got our coffee. Cheers.
Oh, yeah, cheers, brother.
All right. Do you drink your coffee black or with cream?
Nah, I drink it with milk and a little bit of sugar, and that's it. So, yeah, make it home. So,
Okay. What kind of milk?
whole milk or 2% doesn't really matter. Just milk to kind of get that creaminess in there.
Yeah.
So, yeah,
What kind of sugar?
brown sugar.
Brown sugar? Nice.
A little bit healthier for you than any of the other sweeteners and whatnot. So, yeah. Plus, I'm trying to cut weight and maintain weight for upcoming tournament. So I'm trying to stay at 178, and so far it's been there. So
Yeah, so you can't have too much sugar.
too much sugar, too much food. You know, just can't be drinking alcohol that much. Which some days.
Well, after the tournament, you get to celebrate.
Yeah,
After you get your gold medal.
Yeah, exactly. So.
But the tournament you're doing is judo.
Yeah.
And you get to weigh in the day before.
A day or 2 days before. So it's a lot different than
That's easy.
Yeah, it's easy, but it's a lot different from a jiu-jitsu tournament, right? So I have to make sure, like, because I've dropped about 7 pounds to get to weight, and I've been trying to maintain it without having a fluctuation. So just competition readiness is a little bit hard, you know, trying to make sure you're at your weight. But I don't know what goes into it, whether we go just with your street clothes and weigh in, or if they have you weigh in with...
You can weigh in your underwear for that tournament.
Okay, there you go. Perfect.
Chonies.
Yeah, okay.
I feel like I've seen some people even go naked because they have a men's and a women's for the judo tournaments. Like
Oh,
that.
yeah. Because I know in jiu-jitsu, you have to weigh in with or calculate it with your gi on if you're doing gi versus no gi. So there's a different weight discrepancy.
Depends on the tournament. Like I just did the Naga, and you can weigh in the day before or the morning of with just street clothes or like underwear.
Okay.
But then I'm gonna do the IBJJF, not this weekend, but next weekend. And you gotta weigh in with your uniform on right before your match.
Yeah.
So you just gotta...
Different rule sets, right?
You gotta pay attention.
Yeah.
So for you, like you could just, if you're doing 2 days before, you can cut a little bit of water or just be careful how much you drink. And then,
For me, because my weight fluctuates, right? I've been trying to gain weight. Now I'm like, oh crap, I have to lose weight because either I lose a few pounds or I have to gain a bunch of pounds. And for me, gaining weight's a little bit harder. So.
Easier to lose weight than to gain weight?
For real. Yeah, it is.
I imagine a lot of people would love to have that problem.
They would. They would indeed love to have that problem. But I mean, high metabolism, the blessing and the curse, you know? So trying to put on any kind of muscle or any kind of weight, it's really hard just because I burn it off so fast. So, yeah.
Have you always been like that?
Throughout my
High
whole
metabolism?
life. Yep. Tall, skinny, you know, that's just through my whole life. Just especially because I'm so active in sports. You know, I played soccer as young as 4, and I just played multiple sports throughout my whole life. So.
Oh, okay. You grew up around the San Jose area?
Yep. Born and raised in San Jose, South San Jose actually.
Okay.
So yeah, and then I've moved around a little bit here and there, but mainly stuck kind of in San Jose. So.
Where else did you move around to?
Just like North San Jose, San Francisco. You know, I haven't really moved outside of the Bay, but I lived in 5 years in San Francisco, and then came back just because I couldn't handle the weather and the dreariness that the fog and the overcast brought. So, yeah, just nicer here. You actually get your 4 seasons.
Yeah.
You know, so.
South San Jose, like Blossom Hill area, Almaden.
Yeah, exactly. Yeah, right by there. So, you know, Oak Ridge Mall, if anybody knows where Oak Ridge Mall is, like I live right by there.
Oh,
so.
okay. Yeah, it's a nice area. San Jose is so big.
It is.
Like area, square mileage.
Yeah. If you think about it, like San Jose, like proper is like encompassing of a lot of things. But if you actually look at what San Jose is, it's like a vase. Like south is really large and north is like really small, and then you have smaller cities around it that are like considered San Jose.
Like Willow Glen?
Yeah, like Willow Glen is one, but it's like its own city, right? You know, Santa Clara is its own city, but it's like when people talk about San Jose, they talk about that area. So Yeah.
The whole area in between the whole valley right there. Yeah.
Yeah, pretty much. I wouldn't say the whole valley, but like a pretty decent amount until you start going south and you start hitting Gilroy. Then that's like a whole different area because there's just such a larger stretch of distance between it.
So when you were growing up in South San Jose, you said you played soccer. What else did you play?
I dabble a little bit in baseball and basketball, and then what else did I do? Those are the main ones, and then high school I did swimming, and I really loved that. Yeah, so I played soccer for about like 15 years or so, and then I got burnt out on that.
15 years? Oh,
yeah,
wow,
15 years.
I had no idea.
Yeah, from 4 until I was maybe a sophomore in high school. I played, maybe a little bit past that. So and then I switched over to swim. So
you started swimming in high school? So that was like something brand new?
Yeah, brand new, completely. I attribute a lot of my growth to that because it's definitely a very exposing sport. Right?
Oh yeah. I always thought that was like strange, wearing a Speedo and shaving your body.
I didn't get to shaving my body until when I got more advanced in swim, but it like for big competitions, because hair drags in the water.
Yeah, does it make a big difference?
Like milliseconds. Yeah, but sometimes that's like any race, it's like that's the difference between second and first.
Right.
It's like 100%, like a point of a second. So yeah, it was an interesting experience. You could see when I was going through high school, I had a growth phase of like I had jammers, and then race jammers, and then briefs, and then race briefs, speedo, race speedo. So I had like an alternating tan line going up my leg for like 2 years or so until I got like more comfortable with myself to wear a speedo. So
yeah, I mean that's a good thing to learn. It's like you said, being comfortable in your own skin.
Yeah, exactly. So that was one thing I really had problems with growing up, or a lot of people do.
Yeah.
So is being comfortable with who you are, And even now I still struggle a little bit of like with that, but not as much as before. So.
Totally. Did you learn how to swim when you were a kid? Or so you already knew how to swim?
I knew how to swim, but it was more kind of like for recreation.
Yeah.
And then I think it was like a PE swim class. The instructor, who was a swim coach on the high school team, realized how like talented I was. I was like, "Oh, you should join up for the swim team." And I was like, "No."
This was already when you were in high school?
Yeah. So I swam from like a young age, doing swim lessons, stuff like that. We'd go to like the local community pool and just kind of mess around and whatever else. But that was pretty much it for my like swim experience. Like maybe the beach, but nothing like competitive like that.
Yeah.
So. Yeah, until I got recruited to join the swim team, and actually that same coach was the year-round team coach. My year-round team was based in my high school as well. So.
Oh, okay. Yeah. So they had the recruiters like.
Kind of. Yeah. So I couldn't get away with anything with her because she was both my coaches. So if I played hooky in one, she'd make me pay in the other.
I see.
So yeah.
So I feel like swimming is such an important life skill and a great exercise.
Oh my, amazing exercise. Yeah, like we would on hard swim days, we would swim about 5 miles a day. It'd be broken down into laps and stuff.
That's a lot,
but yeah, it is a lot. So, but like when you look at it, you're like, oh, that's not that bad.
Yeah.
And then when you actually, try to think about, wrap your head around the mileage of it, you're like, oh. Wow, so.
That's really cool. I have a training partner. We were doing jiu-jitsu coming up from like blue all the way to brown belt. David Dean, shout out David Dean. He was a swimmer in, I think, youth and high school. And I felt like it really helped his jiu-jitsu because I feel like swimming as an individual sport, that's one thing, it's an individual sport. And then, unless you're doing a relay, I guess.
Yeah, but still individual, but you need your team, your 3 other people to rely on. So it's a weird hybrid of like it's a team sport, but it's very individualized as well. Like you need people to swim with, like jiu-jitsu, you need people to train with to elevate each other. But when it comes down to it, when the match or in a race, like it's all on you unless the relays. It's a little different, but still, when you're in
smaller
there,
case.
yeah, smaller case.
It's almost like the quintet. If we do a quintet tournament, it's possible that you need a team, but for the most part, when you're on the mat or you're in the lane, you're on your own.
Yeah, pretty much, exactly.
So I feel like he had some experience like in that sense, but also like getting to know your body in the pool, like the proprioception is very. I find it similar to jiu-jitsu.
Yeah, because this is like jiu-jitsu. When people say it's like 3-dimensional chess, like it is like okay, I move here, and if I can find a little space here to move, and then I'm gonna move, and you're countering, and I'm countering. Where swimming, like if your stroke is off, like it could mean like seconds, like 10 seconds or more. If your stroke is like really on point, there's still little subtleties you can do just based off of hand placement, that could shave off like a point of a second, like the way since you flip turn into a wall and how you push off of a wall, how you enter the water, like all these things matter. Yeah. So you have to really know how to move your body and stuff like that. So. Yeah,
and in the water, which is it's foreign.
It's foreign because it's there's no gravity.
Yeah, it's buoyant.
Yeah, right. So you're trying to the one thing that I had the most trouble with was I used to do freestyle. So trying to learn how to rotate your shoulders to get like a deeper stroke into the water was hard because you're like, wait, what do you mean? I'm like swimming square and I have to like rotate all the way over. Like trying to figure that out was like crazy. And then I also did I was a butterfly, 100 butterfly swimmer as well. So also trying to like use my legs as like a dolphin. Yeah. Like that was like I just didn't understand. It wasn't clicking with me. So, yeah.
You're more like a seal though.
It took a while. It took a while to get to that point. Yeah. Like when I first started, I definitely, I felt like a duck, like or like one of those underwater like birds, right? Where you're like, okay, like,
you don't belong here.
I don't really belong here, but I can kind of be here. So yeah.
We spent some time swimming together.
Yeah, I remember that. Yeah, it was really fun going to what was it, Mountain View, right? The pool there.
Eagle Park.
Eagle Park, and then up north to what was that river we were doing for your Ironman? That one was really fun.
The Russian River.
Russian River, yeah, that was really fun.
Yeah. So I didn't learn how to swim until I was in my 20s. Okay. And I had friends in jiu-jitsu. We would go to the pool to go swim laps, and I could barely make it to the side, to that one end to the other end, without being exhausted. Yeah. And then
that's a lot.
And then one of my friends, the main thing that blew my mind was learning how to breathe, which was like, oh, you breathe out underwater. Oh.
Yeah. Otherwise, if you breathe in above water, and like if you don't have a full enough breath out, like you start choking on water, right? It's very easy to do that.
That blew my mind. Yeah. That's something simple like that. I don't know what I was doing before, if I was trying to breathe out and in above and then go back down.
Typically people do that, is they do that and they inhale a lot of water. So it makes it easier in that split second as you're breathing out. When you come up to breathe in, that's all you're doing is just breathing in. Yeah. Right? Yeah. So there's a timing and there's like, little nuance to that.
I found that was the most important thing that I learned. And then once everything else from there became easy.
Relatively easier, right? There's still the depth, and then there's still like, can I float? Can I move? Yeah. People get freaked out about that. Even just regular pools too.
Yeah, that was terrifying. Sometimes when I was swimming at Eagle Park, because it gets pretty deep, like 10 feet, 9 feet, and I look down and I get a little scared, like, oh, that's deep. That's deep. Yeah. Even though the wall is only like 3 feet away.
But it's like people, and like mind is a very powerful thing, right? Yeah. It's a few feet away, but for you, you're like, oh my God, it's like miles away, right? Yeah. Or like the depth of the pool, you're like, dude.
If I just sink right now.
Yeah, like, oh, I'm gone, Yeah. But no, the way I picture it is like, when you're swimming, no matter where you are in the water, like you're always on this level, right? Like, yes, you can dive down and there's a different level to it.
Makes sense.
But like, it's like the floor. Like when we're walking, we're always at this level. When we're swimming, we're pretty much always at that level, unless you voluntarily go down. Yeah. So it's just a different mindset of like where you are in space.
Yeah, that makes sense. I mean, that totally makes sense. I think you explained that to me when we were swimming too, like, because we swam in the river, and you helped me a lot with my technique, and then like I would get freaked out in the river, like, oh, it's really deep.
You can't. The vision you can't see within like a foot in front of you. Yeah, no, that was definitely very.
You don't know if the seals are biting or not.
right.
They might be friendly or they might not be.
Friendly or not, right? You're like, what else is swimming here with me? You know? Yeah, no, it's just a lot of it is, like I said, the mind is a very powerful thing, you know. Even in jiu-jitsu, you feel like a lot of, like, especially like the things I see on Instagram, right? Like the high calorie grapplers versus the victim weights, you know, and like it feels like you're drowning, right? But like if you get your technique under you and you get a good spot where you can kind of like be able to breathe, and I'm like, okay, this sucks, but like I'm not dying, and I'm not, you know, super uncomfortable. Like you can chill there for a little bit. So, and actually when I was first starting back to jiu-jitsu, you were really good with me on like, because I would always just outburst, like really high intensity, fast pace, right? And you're like, oh no, you need to know how to float and when to swim. You know, so you turn that back on me when we were doing jiu-jitsu and trying to learn, like, oh no, there's a time to like chill, and there's a time to explode, right? So
totally, and like knowing when, right? Is hard.
Yeah,
it comes with experience.
It comes with experience for sure. And at first I was like, I didn't understand, and then now it's been crazy. Like I know, I'm like, okay, I can kind of chill here. I'm fine. Yeah, you know. And again, like, you know, frames are a big thing. Like your technique is like being able to be in a spot where you're comfortable, right? And then being able to identify like, what can I do to get out of here, right? So, and then that's when it's like, okay, let's go, right? Whether they move or you move, right? Yeah. So
taking advantage of the timing, knowing when. Yeah, that's a good point. When did you start jiu-jitsu?
I started in college, so in 2012. That's when I went to San Francisco State. That's when I moved out and into San Francisco. And then it was through a club, so it was a bunch of dudes that were wrestlers, and they did no-gi. Unfortunately, that club kind of died within the first year, so that was kind of a weird, like I wanted to do more, but you know, no one was really like, the club kind of disintegrated and then slowly reformed later on, which I didn't know of until afterwards. But yeah, no, it was hard because like I was a tall, lanky, really light, skinny kid. And guys would just one of my training partners I always thought about was this big buff guy. His name was Alex as well. Big beard, bald. Had him in an arm bar, and he just straight up, you know, bicep curled me out of that, and I was like, well, you know, like
jiu-jitsu doesn't work.
Well, it does to a certain extent, but like, man, I definitely did not have that experience. But he also was a very big wrestler too. So like I said, a lot of no-gi guys wrestler guys who got into no-gi competitions and stuff like that. So there was a little bit of a structure, a little more unstructured. So
did you have like an instructor there, or was it just guys that got together and rolled?
Technically, I think the guy who was heading the club, I think he was either a brown or a black belt at the time. But I didn't really know, you know, just because like I was like, oh, no-gi, you know, and you can't really tell because of you don't have your belt on you, right? But I didn't really ask. I didn't really know. I definitely knew he was a higher level. I just didn't know where in that level he was.
Who was it?
I don't even remember his name, to be honest. It's so long ago.
2012.
2012.
San Francisco State.
Yeah.
Why did you go to San Francisco State?
At first, it was far enough away from home where like my family wouldn't bother me, but it was close enough where I can go home whenever I wanted. There was a lot of family problems between my dad and I. So long story short, I just went there, you know, close enough where I can stop in. And again, you know,
get some distance, but also it's not too far.
It's not too far, and
plus, hour drive or more or less.
Plus, I also didn't do my due diligence in the research too, because I was looking for. I didn't even know what I wanted to go into, but I knew. So going into college, you didn't have like, I want to be a chiropractor. No. I had a plan, kind of, but it definitely evolved. At the time, I was really into like art. right? So I was like, oh, I'll
kind
do
of
some art. Just drawing, you know, animation type stuff. I used to do a bunch of doodles in a sketchbook. And then as I was getting closer and closer to going to college, I was like, well, I would see like kind of what the industry was like, and I was like, I don't know, like maybe art and business, you know?
Yeah.
I compare those two, because, you know, business is very broad and encompassing for everything, right?
Sure, it's a good skill to have.
It's a good skill to have, and then eventually
if you're an artist, you're gonna be starving, right?
Yeah.
Starving artist.
Yeah, exactly. And that's actually kind of one of the reasons why I decided not to do art anymore, was because I was like, dude, I don't want to be like that, you know? I don't want to be struggling that hard, because it doesn't sound fun, you know?
Right.
So I was like, okay, business, because I really didn't know what else I wanted to go into. And at the time, I think it still is, but San Francisco State is known for their business school, right? But as I went through and I got accepted and did a couple classes, I was like, oh, business is not for me. So I had to figure out like what.
They put you in the most boring class the first semester, like, accounting.
Dude, no, I had business calc. That was hard.
Calculus?
Yeah, business calculus.
Business? Who the hell needs this business calculus? All you need is arithmetic.
I don't know.
Maybe there's some.
I don't know.
Maybe
I don't know.
Some
but and then the second class was the one that I remember was I think it was a macro econ class.
Okay.
But my professor had the heaviest Indian accent I have ever heard. So trying
you couldn't understand?
Oh my God, trying to understand what she was saying, like took all my energy. And that was like, just to understand what she was saying. That wasn't even like
the content.
Yeah. Oh my God, yeah. So I had a very big like kind of find myself moment in college, and I was like, I took a paper and I was like, what are my interests? And I wrote them down. And then I try to correlate those interests with majors. And then I was like, well, I don't want to do this. You know, I don't see myself doing this.
Yeah.
So eventually I was like, hey, I'm a very big athlete. I've loved sports. I've loved doing this and this.
Yeah.
Like, what can I do with this? And kinesiology jumped out at me, because I was like, oh, study of movement science, sports science. Oh, cool, let's do it. So hindsight, I probably would have gone to San Jose State if it was for kinesiology, because they have a better program. But didn't know that at the time. I was already in San Francisco State, like I was there. So, but yeah, that's how I got into kinesiology, and I actually wanted to be a personal trainer originally.
Oh, okay.
Yeah.
Nice.
So, and actually around that time, 2012, 2013, it was I actually started Judo at that time.
At the club there?
They actually had a class. At one point, I needed credits, and because kinesiology was super, impacted. Like there was too many students for the faculty, for the class space, stuff like that. It took me a while to get into the major. So in order to keep my scholarships, I needed 12 units of classes.
And some classes were full, you couldn't take.
So I couldn't take it. Yeah. I was on a wait list, you know, I was applying to different classes, you know, didn't get into any ones I wanted. So at one point, I was taking upwards of like 4 PE classes. It was like swim, weightlifting, judo was one of them, and I forgot what the other one was.
But the swim, you were part of the team.
No, this was
as a swim team, you also get credit for that, right?
So here's the thing, though. So when I went to San Francisco State, they were telling me like, oh yeah, we have a swim team, you know, to get me to come. Because otherwise I had a scholarship lined up for swimming at Santa Cruz, UC Santa Cruz. But I was like, oh, I'm gonna go to San Francisco, you know, because if they have a scholarship, I can, you know, dumb down the price a little bit. Come to find out, they hadn't had a swim team for 10 years.
Oh, really?
Yeah, so I was like, wow. But also in hindsight, like being a student athlete is a lot of work. And being able to manage your time and studies by yourself is difficult.
Right.
You know, like having a social life, having to go to class, having homework, but at the time I was also working too. So trying to balance all these things, I was like, man, if I was a student athlete, that would have been very hard, because you need a minimum GPA to be able to be that athlete.
Yeah.
Otherwise, you know, you can be on academic probation, you can get your scholarship revoked, right?
Yeah, you need a lot of help, because as a collegiate athlete, it's very demanding.
It's very demanding, and that's not even
the
including
hours you got to put in and the travel.
Yeah, the travel, the hours. That's not even including like the training times too. I didn't even include that into like my thoughts either. I was like, oh, okay. So it kind of worked out where I wasn't on the swim team at San Francisco State.
But they didn't have a swim team?
They didn't have a swim team.
So did you swim there?
I swam there for a class, actually 2 classes, but then I just kind of swam there because I ended up working as a lifeguard at the pool they had.
Oh, okay, so they have a pool where people can do recreation or they had classes.
Yeah, they
so
both.
You were the lifeguard there during rec or during classes or both?
During rec. Yeah, the class was early enough where most of the people who were swimming were actually lifeguards in the class. But no, during the rec time, like I was actually the lifeguard there for a lot of people because a lot of people didn't know how to swim there either.
Yeah.
So.
Did you ever have to go in and save somebody?
Close to. We didn't have, but luckily it was just kind of like a just stand up, you know, type of moment.
Just like jiu-jitsu.
Yeah, just stand up, right? No. But like this is where we go back to like my mind is a powerful thing. Like the depth, it was like, oh my God, like they're freaking out. And it's like, no, just put your feet under you. You're good, you know?
Yeah, some of those pools like are, I mean, I don't know the pool there, but some pools are like 4 feet the whole way across.
Yeah, and that's rough, especially for me being so tall.
Yeah, like touching the ground.
Yeah, I got a 6-foot wingspan. You know, like I'll be touching the ground every time.
Yeah, there was a pool in Palo Alto that I would swim at, and it was like that, and it was just like
horrible.
It's terrible. Yeah, I feel like
you can't dive. Otherwise, you're going to be smashing on the ground, right? Your strokes, like you're getting really close to.
And even if you're not that close, like me, I'm not as tall as you, but just the feeling that it feels like
I'm gonna be hitting.
Yeah.
Right.
Or if I don't know, you feel like you don't have much freedom in the water. Like if I wanted to like move, like
there was none, right?
So that was strange. I'd rather have in a pool. I'd rather have a deeper pool.
Yeah, I think they had a 4.5 or 5 foot at the shallowest, and then it did get down to about 9 or 10 at the deepest.
Yeah.
So yeah, it wasn't that bad, but.
Do you think there's like a science behind like if I'm on a shallow side I swim faster than a deeper side, or it doesn't matter? Because I feel like the buoyancy changes, and I'm not sure if that's true or not.
I don't think it is because the buoyancy is the same thing throughout the pool, whether it's deep or shallow, right? Because I
feel like the deeper end wants to pull me down stronger.
No, that's just your imagination.
Probably.
Right. But I do know when it comes to like body type, that definitely has an effect. I had a friend who was just pure muscle. Like as soon as he jumped in, he sank like a rock. Yeah. And I had some friends who were a little bit fluffier, and they had no problem. No problem floating, right? Yeah,
I grew up in high school. We did swimming for like a unit, right? And I was terrible. And then we had this one girl. I remember her. She was fluffy, and she was on the swim team, and there was like her time to shine.
Yeah.
It was like slaps. She's floating. She's playing. And I'm like, dang, like you know. I'm not saying that. The reason why she was good is because she's fluffy.
Because of that, but it was like it definitely helped, right? So, yeah.
So then you decided to do kinesiology. Was there certain focuses on the kinesiology, or was it just like general kinesiology?
No, there was focuses, and I did. It's called EMS, Exercise Movement Science. So that was my focus on that, and like I said, I was planning on going to either personal training or I kind of wanted to do biomechanics, to be honest. But I was more leaning to personal training just because I was like, okay, I love going to the gym. I love working out. Like, let's do this. And actually just some things led to another where I missed one class, and it kind of was unfortunately a daisy chain to my last. So I ended up staying over like a year. I could have graduated a little earlier, but I ended up picking up a minor in holistic health, and that kind of like introduced me to more of like, the alternative medicines, I guess, like massage and different things like acupuncture and whatnot. So, or like Chinese medicine, that was one that I got experience into as well. So, so it kind of led me down into like where I am now. But the main push was like a friend of mine. He was a year ahead of me. And he was like, "Oh, what are you gonna do when you graduate?" And I was like, "Oh, dude, I'm gonna do personal training, And he's like, "No, screw that, don't do that. Like, come to go be a chiropractor. Go to Palmer Chiropractic. It's San Jose." And I was like, "Oh, I'm from San Jose, you know." But I had no idea what chiropractic was.
Oh, really?
Yeah, no, I had never been treated chiropractically. Like growing up, it'd be like, oh, my dad or my brother, I'd be like, "Oh, lay down," and we'd crack each other's back, but we didn't know what we were doing. Just like, oh, it feels good,
Yeah.
But I didn't have experience in chiropractic until 2017 when I went to grad school.
After you graduated?
After I graduated, yeah. So, and then lo and behold, I'm here, you know. So, yeah, it's been quite a journey, you know, and trying to get back into personal training, which I'm doing through a friend of mine, or ours, Alicia. She owns a gym just down the street, so I'm doing personal training there.
Shout out A-Team Fitness.
Yeah, A-Team. But yeah, doing personal training over there, which has been really cool, because at one point, as I was being a chiropractor, I was like, do I want to continue this? Do I want to change? Like, what do I want to do with my life? You know, and it's daunting, you know, trying to figure out like a career that you're going to do for your life.
Yeah.
You know?
It's scary, yeah.
Yeah.
It's commitment.
Oh my gosh,
Yeah.
I know. Because then you're like, for life, I'm only like this age, you know, like I have X amount of years in front of me.
Yeah.
So, yeah, lots of reflections going on, like at certain like big turning points. And my recent one earlier this year was like, okay, now I want to do personal training, kind of more focused on that.
And that's kind of cool that it came like full circle, because that was what we wanted to do originally. But then you got taken down a path to learn chiropractic care, and then now you're in a position right now where you're doing both.
Yeah, exactly, and I love it. You know, I wouldn't give it up for anything right now, because I can do treatments, and then I can be like, hey, like I think we need to do something to activate whatever or loosen whatever muscles, and let's go out to the floor and let's do that. Let's give you some workout plans, because my view on chiropractic is like it should be a tool to help the body and help you heal, right? Because everyday wear and tear, you get tweaked, you get pulled, you get strained. Like let's try to get you back to that prior before that happened, right? And then on top of that, the personal training is like embodying the individual to be like, oh, you're stronger than you think, like you just have to commit to it and work at it a little bit, right? And also to kind of bring on a sense of like self-worth, I guess, or like if something goes on in life, like, okay, you can handle this, right? Like, or like if you're not feeling good, like, oh no, I can take care of myself and figure this out, right?
That makes sense.
Yeah, empowerment, that's what it is.
Self-empowerment.
Yeah, self-empowerment, yeah. So it kind of like, I like meshing them together, because a lot of people, they're like, oh, I'm so weak. I'm like, no, you're not. You're so strong. There's some people like I see at the grocery store, like they see a weight and they're like, I can't do this weight because of the number, right? But then I see people like yoking groceries. I'm like, do you know how much that is?
They got that big old rice bag.
Dude, that big old rice bag. Some of those rice bags, some of those rice bags are 20 to 50 pounds, and like people just freaking, and I'm like,
like
you know what you just
strongman
did?
contest, like,
yeah, exactly. And I think it goes into like I said, the mindset of it is like, you see a number and you're like, I don't know if I can do that.
Yeah.
But then if there's no number, magically like, oh, you can do that. Like, people move all the time and they're like rearrange their furniture. I'm like, you know how much that furniture weighs?
Yeah.
Like you can do it. It's just you have to believe that you can do it. So.
That's true. I also feel that like for me, personal training or like weightlifting or exercise is a great way for preventative care.
Yes.
And then chiropractic also preventative, but also like treatment. Like, okay, when I was working out or when I tweaked my neck, right? I have my hips, and now you're gonna, as a chiropractor, you can help adjust and fix that. And then I can, on myself, through my self-empowerment, through working out, I can do certain exercises that can strengthen the muscles around it, that can help like
stabilize or loosen or whatever. Yeah, no, I 100% agree. Like I said, day to day, people get tweaked in some way, like the way you sit. If you have a habit of leaning away, a certain way, or if you have a repetitive job, bring it back to swim. Like I had swimmer's shoulder, right? So that's just overusing the shoulder because you're doing
on both sides.
Both sides, mainly the right.
Because you're strong. You're right-handed.
Yeah, I'm right-handed. Yeah, so you're developmentally, you're stronger, a little bit more developed on that side, right? So I had swimmer's shoulder just because of repetitiveness of doing like an arm circle over and over and over again.
Like repetitive movements.
So that puts a lot of wear and tear on the tissues, and then that on the joints and stuff like that. And
so I imagine swimmers do a lot of band work.
They can do a lot of band work.
Like
lately, from what I've seen, they do a lot of strength training or like resistance work, band work in the water, right? One we used to do is we would attach a band to the starting blocks, and we would swim with that band as hard as we could.
Oh wow! And so you guys would stay. You guys wouldn't go anywhere.
Wild, yeah. You get to a certain point, and the band pulls, and you're like not going anywhere.
Oh, it would suck if the band broke and hit you.
Oh yeah, we hadn't had it because they were like pretty thick tubing, but no. So like that's one way of like that is a strength training, but people don't realize it because you're like, oh, it's a band, you know?
Yeah, and I think like the band work is really good, like because in exercises like that, or like in baseball, we used to use it a lot for our shoulders. Because it allows that range of motion.
Yeah, exactly.
In the water, you have full range of motion. So then if I'm just doing like lat pull downs, it's gonna help.
Partial range of motion, right?
But I'm only going in one direction.
Yeah, and that's the nice thing of being able to pair chiropractic with personal training. Like personal training, I knew the exercises to do, but chiropractic, I knew like, okay, like this is the range of motion for these muscles. You know, this is what muscles we're trying to hit with what joints we're trying to affect, right? So yeah, a lot of it's like preventative care for a personal training. It's like, okay, can we stabilize that area so it doesn't go out? Or if it does go out, like, is it because the muscle's too tight because of like a weakness or insufficiency, right? Or like tightness, right? Like, what's going on there? And sometimes it comes down to like, oh, my quads are really tight because my hamstrings are really weak or too stretched, you know? So, or vice versa, you know? So it's like, okay, if we can kind of work on that imbalance, like, oh, a lot of problems will go away, you know? For example, college, this actually happened to me where I was rock climbing, I was doing judo, and I was weightlifting, and I was doing that pretty religiously for 4 or 5 days a week. So that's 3 hours just right there, three plus hours. And I would be using my grip strength so much that I actually got like really bad like tendonitis in the middle of my elbow. Right. And doing some like self-studies and stuff like that, I found out like, well, because we're grasping so much, my flexors grew more significantly than my extensors. And so there was a really big like muscle imbalance there.
Who works out extending?
That's a good question.
Like how do you do that?
Yeah, I don't know, like...
but that's probably a great way to relieve some of the pressure.
To relieve some of the pressure, yeah. And that's what I did. I just carried around a rubber band, and I would put it around my fingers, and I would just do pulses, or I would do holds with like wrist extensions to really work this area. And in about like 3 months of like consistently doing that, like pain went away, you know? So that just shows like, hey, if we start strengthening that weaker area, it'll start balancing out that overworked area. You know?
So as a chiropractor and as a personal trainer, you can see somebody and then you're like, okay, you have imbalances here, so I can diagnose and give you a workout plan.
Yeah, workout plan or a stretch plan, or like a lot of like people have a misconception of what chiropractors can do. You know, people are like, oh, you just crack bones. And I'm like, well, that's called breaking, and you don't want to do that because going to the hospital for that. But no, I'm like setting the joints, and I'm regulating, because the reason that it's called a musculoskeletal system is the muscles attached to the bones, and so if one moves or if the other moves, like they respond together.
They're moving together. They're not like in a vacuum. Like the bones are doing this and the muscles are doing this,
right? So. Yeah, it has an interconnectedness. So if I see someone's posture or the way they lift, I can be like, hey, we may either need to treat to get you even, right, and see how that goes. Because sometimes like just getting your bones into like a more proper alignment will just help the overall area relax, so you're not like straining too hard in one. For example, I tend to lean to my right a lot, so I put a lot of weight on my right hip. And so what ended up happening was I was squatting, and I was squatting body weight. So at the time was 175, 180, and I was trying to go depth, and I was lots and lots of reps.
Ass to grass
as best as I could, but the last two, on the 10th rep, I felt something slip out in my low back, my hip. Yeah. And I was like, oh, that sucked. That didn't feel great. Yeah. But me being stubborn, I gotta get 10. I got 2 more. I got 2 more and I'm done. And it's usually those last couple that mess people up the most. Right. I threw out my sacrum, I threw out my low back. Like I was very uneven to the point where like I couldn't walk. Like it hurt to walk at all. So that's a very big example of like, hey, like that moved, let's move it back, you know, and just a simple adjustment like allowed me to walk. And then the rest of it was like, okay, let's stretch or let's do some strengthening in that area to kind of stabilize it so it doesn't do that again, you know? Because I have a very hard time getting past 90 and going down too far with my range of motion for squats, because that's where I'm weak. So
which I imagine most people are weak at that part.
Because we grew up sitting on chairs.
Yeah.
You know, like this is very, you know, Eastern Asian type of thing. Like we're like sitting on the ground or whatnot.
For an extended period of time.
Yeah, for an extended period of time.
I guess we're kind of used to it now as jiu-jitsu people.
Relatively, right?
Relatively, right.
Yeah, but that just goes to show like a range of motion is very, very different, you know? But yeah, no, it's great to be able to like be like, oh, I can see what's going on based on your posture and like what muscles are tight, what might be like loose, what might be giving you problems. Because now what I'm running into is trying to figure out, okay, well, you're feeling pain. Well, why is that pain coming on? Is it too tight? Is it too loose? Is it not firing right? So then everything else in that area has to like jump in to stabilize. Like it's like a nice little puzzle game of Clue, you know? So that's the nice thing about chiropractic is like I can see that. I can be like figure things out. It's a nice little journey, puzzle, if you may. And then the personal training is just like, okay, now we got you back here. Let's strengthen up the whole. So, yeah.
Nice. I see. It could be challenging and exciting to like try to like help somebody, but also like you said, it's like a puzzle. Try to figure it out, and then you can balance the personal training with the chiropractic care.
Exactly. Yeah.
That's awesome.
And the nice thing is too is well, you know, chiropractic versus, you know, traditional like modern medicine right now. Like modern medicine, they try to focus like, oh, your shoulder's out, let's work on the shoulder only, you know. But for me, for chiropractic, my viewpoint is everything's integrated. Shoulders out, it could be in your neck, it can be in your mid back, it could even be in your low back, you know. Like you were mentioning lat pull down a while ago, well, that attaches down in your low back and it attaches up into your arm, but a lot of people don't realize that, and they don't put the two and two together. So when I see like a shoulder problem and a low back problem on the same side, then I go, boom, this is the cause or potentially the cause of that, you know. But it's an onion, right? Like if I peel back, oh, release the lat, is it really that? Or is your shoulder out? Let's peel that back. You know, it could be something else. Yeah.
And you're gonna run certain tests or run certain exercises to figure out what it is.
Yeah, exactly. So a lot of people just don't understand exactly like the scope of what we do, right? Like we can do some physiotherapy stuff like soft tissue, pin and stretch, cupping, scraping, rehab type stuff, which again leads into the personal training. So like there's a lot that we can do for you. So
I feel like I've always grown up with chiropractic care. My father always went to a chiropractor since I was a young age. I would go with him, and I just found it as normal. Yeah. And this is a great way to, like my dad, he was a mechanic. He had back problems. Yeah. Being under a car.
Under a car, over the hood, or into the hood. You know, lifting what they have to lift. So yeah.
And then, so that was, I grew up with that, but I feel like some people have like a fear of chiropractors and or they feel like, oh, chiropractic doesn't work, it's just like
like witchcraft.
Yeah, exactly.
You know, yeah.
As a chiropractor, like what are the common fears, or what do you do when someone says like, oh, that's just witchcraft, it doesn't work, you're just trying to bop, so I feel better and get me coming in next week?
Yeah, so everyone's different, so I'm gonna put that as a kind of caveat. Like this is my approach to it. Other people might do differently.
Sure.
First off, the concern of being trapped into like, you know, getting seen X amount of times a week or whatever. There are some, in my opinion, some excessive treatment plans that people have, and I'm like, okay, if they're coming in for maintenance care, there's no reason to come in 3 days a week, right? Like if you're injured, heck yeah, come in 3 days a week. We need to get that moving. We need to get that so it doesn't stay that way in that movement pattern, right? But if it's like a maintenance thing, like once a week, once every other week, maybe once a month, you know, like is kind of like what I try to get people to. And I kind of like, you know, I have to gauge it. Like, how bad is it? I had a patient once that had to literally carry him from his car into the treatment room because he couldn't walk because he threw out his back so bad.
Yeah.
Like that is a 3 days a week, like for a few weeks to get you to be able to even move.
Right.
You know, and then once you get through some of that, then it's like, okay, we're gonna, you know, dial it down a bit. But like the package deals or like the thought of like, I'm gonna be stuck into this, like no, like come in to see me whenever, you know, life happens, things happen, you know, you might have woken up weird and tweaked your neck, like come in, right? Just to get it checked out or utilize some of the stretches or exercises I give, which I like to do a lot for people, just to empower them and be like, hey, I tweaked my neck, let's see if we can do this. And if it doesn't go away, like then I can go in, right?
Yeah, and that must make them feel like
they have control.
Yeah, and you're also like, hey, like if you can do something on your own, and then instead of coming to see me twice a week, you can only come once. Or
right?
instead of once a week, you can come once a month because you are being diligent on your self-care.
Yeah, and I understand like treatments are can be kind of pricey, you know, like so it's like, okay, people are like, oh man, do I have the funds for this? So it's like, well, do you want to be in this pain for all this time? Like, how can we get you out of it so you can actually enjoy your life?
Someone told me one time, which makes a lot of sense, like, if you're either going to have to pay for it, you're going to have to pay for it in some way or another.
Some way, yeah.
Either you're going to pay for a professional to work on you, or you're going to pay for the work that you're going to put into, what you can pay with the pain, but like if you want to do self-care, you're going to need to be diligent, meaning, you know, an hour a day or whatever it is that you need to be stretching or doing some sort of self-care, working out. Like me, man, I'm so physical every single day and I'm so busy. Like I'd rather pay a professional who knows the body and who can be like, hey, you're messed up here, let me do this. And I can just sit down and relax. And for me, I love like getting my chiropractic care with you, or going to get a massage and just like having the professional take care of me, and it's worth it. It's worth it.
Perfect. This is like the time versus money type of thing, right? Right. You don't have any time, so you're willing to pay the money to get treated. Some people, they may have a lot of time but not have the money, and it's like now they have to really balance like, what do I want to do? So it's like mine is like, well, what are your goals? Do you want to be stuck here like that? Okay, cool. You know, or do you not have the time or the patience for it? Like, cause my treatments are half an hour, you know, and I'm willing to kind of, you know, deviate and like go upwards of like 45 minutes on people, depending on how much they need. Right. Cause I'm flexible with it. So like, but I try not to like go any less than that. Right. Because like, there's so like the body's so complicated, you know, and
I've been to different chiropractors where it's like 10 minutes or 5 minutes. You're out. Like, oh, okay, see you next week.
I used to work at a corporation like that, where it was like 5 minutes in and out, and I would get in trouble so much because I would try to add in a little bit more and make it like 8 minutes, 10 minutes, and I got a lot of
cared, and you're like, hey, I want to help them.
You know, I want to help them. This is why we're here, you know, as like, you know, healthcare practitioners, right? Yeah. But on business side, I was losing business for them because they weren't seeing enough people. Yeah. Which is like, okay, well, now you're looking at all the patients as like dollar signs. Yeah. And then instead of like people.
You can't even make small talk.
Yeah, right? It's just like, how's it going?
That's part
lay
of your
down,
job, right? It's
yeah,
like
it's just it's to build rapport with patients, you know?
Like you're about to grab my neck and twist in a weird direction.
Yeah, and that's so speaking of, that's the other thing.
I want to be
comfortable and trust
myself,
you.
I've been in a chiropractor for years and years, and when someone grabs my neck, I consciously have to try to relax because your reaction is, like, don't grab my neck, bro. What are you doing?
Oh yeah.
I do jiu-jitsu, get out of here.
Get out of here, right? Exactly. And like even subconsciously, I do that a little bit. You know, personally, and between even my peers who address me, and I trust them. Yeah. If I have an injury, I subconsciously just tighten up. I may feel really relaxed, but they're like, hey, you need to relax. I'm like, I am. Oh no. Hold on. Yeah, and breathe. Yeah, but that's the other thing that I wanted to get into is like the fear of, because action movies, right? Oh yeah. Yeah. Right? And like, oh, neck broken, right? And I'm like, dude, if someone's doing that to you, one, they're not gonna have any patience, and there's gonna be a very big legal problem there. Two.
Can you break someone's neck by twisting it like that?
Yeah. It's
and kill them?
Potentially, definitely.
They make it seem so easy in the movies.
Yeah. It is relatively easy, but also there could be, if they do, like something they do survive or whatever, there could be permanent consequences for their own health, right? Like a very big thing is like, I don't want to be paralyzed, like a paraplegic, right?
Yeah.
And I'm like, okay, I'm not going that far, like you see in the movies, they completely, like an owl, they can turn their head over, 360 degrees, right? And you're like, how is that happening, right? But for me, I'm like, hey, I'll tell them like, one, this is all I'm gonna do. I'll physically show them
the motion, the range of motion.
Yeah. And then I'm gonna push through, right? That's all I'm gonna do. So like no like crazy whipping motion, right? Because people just naturally, like you said, people touch your neck, you just get tense. Right, and that's just like a survival factor, like a survival mechanism, right? Like this is vulnerable, so let's like protect it, So that's a very big thing of coming toward like patient, trust and care is like, hey, this is like letting them know, like, hey, this is what I'm gonna do. Like, is it okay? Cool. If not, like I have other tools that I can use, like an activator. It's like a little clicker that I use. Very, very low force, gets in and out really quickly, and it's hard because anatomy of our hands, like trying to make a bone move, right? I need like a specific amount of space because that's how my hand is, right? But if I try to like jab you with my finger, like my finger's gonna be breaking, right? Because of that. But a clicker, like an activator will go in there and it'll move it a lot nicer and easier.
Yeah.
A lot of people, I'll do an activator adjustment on them and they're like, that was it? I'm like, yeah, that was it. And here, look, range of motion's better, muscles are released, this and this,
And sometimes that's all you need, right?
Yeah, sometimes that's all I need. And sometimes my philosophy is less is more, because you can always put in more force, but whatever force you put in, you can never take away. Right. So some people I know, the big linebacker type dudes adjusting little people, like they don't always understand what it means to be 260, and 6'5", adjusting like a smaller person, like who's like 5'2" and like 100 pounds, like that's a lot of force, and and sometimes people are too aggressive and too like unnecessary with it, like, and that's where it goes into like, if I adjust, it's better to be lighter and it not go, or it move a little bit and get some relief than to be like, I want to smash and I hurt someone, right? Because I've seen it and it happens, more often than not, unfortunately, because people just don't know how to moderate. Yeah. So
that makes a lot of sense. Like you can always like start slow and then pick up the intensity or pick up the pressure when you're doing your chiropractic techniques.
Yeah, 100%. And so knowing how to, and also it's just like a patient comfort thing, but then also people don't really realize it's a doctor comfort thing. I know some techniques in chiropractic where people had to retire from a chiropractor because it was so rough on their hands and stuff like that. It's unfortunate. Yeah. And it's like, well, maybe if you would have done something different, your technique, your power, the way you contacted, like it would have been better. Like a very big one is like, I sometimes see people that are super tight where I press into them, I'm like, that's not budging, and I'm like, well, instead of me adjusting you right now, like maybe let's throw some like stim, like muscle stim on you, right? And muscle stim is, there's 4 electrodes and it's typically 2 and 2, right? And I cross them to deliver some electrical stimulation to help relax the muscle, right? Because what happens is when people get really, really, really tight, they're not budging. Right? and you're gonna hurt yourself. I'm gonna hurt myself, and I've done that before. At that corporation I was telling you about, I was adjusting upwards of 60 to 70. You don't have time to throw on 20 minutes of stand or whatever. Yeah, no, but like at the same time, at the other corporation, I was adjusting 60 to 70 patients a day. What? Yeah. That's insane. Yeah, just 5. So the wear and tear on my body was immense. Yeah. And the burnout was crazy, And some of these guys were not small people. I had one that was like 6'7", like 300 and something pounds, but he was pure muscle. And I had another lady who was like, you know, like I said, like 5'4", 5'3", and she's
imagine
like,
if they came right next to each other, like
Just
300 pounder, 100 pounder, and then you
Yeah.
have to like adjust yourself in a short period of time.
Yeah. So, and it's crazy just the variability, right? But it's like, okay, if I can take out as many variables as I can to be able to like get to the spot I need, like I'm gonna do that.
Yeah, that makes
without injuring myself, because I do jiu-jitsu and judo. Like I don't have time for that. You know, like I've even messed up myself in training, and I still come in the next day to treat people, even though I'm limping in.
Yeah, you don't have a choice. That's your
I don't
career.
have a choice. That's my career.
You gotta be
you
careful
know.
of your body.
Yeah. So it's like, you know, like people really think about the patient comfort, but they also don't realize the doctor comfort, because I'm like realistically touching you, right? So whatever force I give, it goes back into me.
Yeah.
You know.
That's true.
So.
What is it, like force cannot be created or destroyed, and any action is an opposite and equal reaction.
Yeah, exactly.
So,
it was like Newton's law, right? Yeah, exactly. That's 100% it. So, no, those are some of the concerns that most people feel, right? And another thing is just like, you don't have to come in for just chiropractic. I have people coming in for just cupping sometimes, or soft tissue work. You know, like if you're not comfortable with it, I'm totally fine with just not doing it. You know, some people
there's
like,
other ways we can get.
There's other ways, yeah. And if there's not another way, if somebody tells you there's not another way, like BS. You know, you should find another way. You should do your research, or you know, maybe that person's not right for you. You know, there's always an option C. There's never a clear and cut like black or white. There's always that gray area in the middle too. So.
Do you feel that chiropractic? So you did jiu-jitsu. So I want to kind of blend the two.
Yeah.
You did jiu-jitsu. You got introduced in college. Did judo in college, and now you're training here, jiu-jitsu and judo with Daruma Dojo, and you also train judo with Chuck Jefferson.
Yeah, CJ a little bit, and shout out to CJ too for also putting on a San Jose Open this weekend.
It's gonna be a great tournament. I refed that tournament before.
Yeah,
so
I remember.
I'm not gonna ref this time, but
bummer.
Most likely next year, because I have to do it once every other year to keep my national referee.
There you go.
And I like that tournament. I like what they're doing. But do you feel like your experience with anatomy and chiropractic care, does that translate to your jiu-jitsu or vice versa?
I think it does a lot, because I know what I'm affecting, right? You know, take an arm bar for example, right? Like people don't like, okay, extend here doesn't bend that way, right? You know, you're strong here, right? But that's this way not so strong, right? Can cause injury. Something more complex is like the shoulder, right? Like there's so much free range of motion, but like how do you know, in jiu-jitsu, how do you attack a shoulder, right? There's so many ways to attack it, but most people go Americana, Kimura, what else? That's typically it.
Omoplata.
But
it's mostly this way or this way.
Or this way, right?
Yeah, but there's also like this way.
But there's so many different ways. Like
that's a good point. Like because of your understanding of the range of motion, you can get a little more creative.
Oh yeah. And some of my attacks are off of that, you know. And people comment on like, I didn't expect that to happen. I didn't expect to tap to that. I'm like, well, like I know how much this muscle, this area stretches or doesn't stretch, you know. Like I'm gonna use that to my advantage. Like I do a lot of shoulder crunch stuff, you know, and like, or like either whether it's like, you know, Gordon Ryan when he does the butterfly or half guard and reaches through, shoulder crunch through there. I do that, and people don't realize like, if I block your body from moving and I crunch your shoulder down here and it all directs it through that front of the shoulder, like it's gonna hurt. It's gonna feel like a stretch. It's gonna feel not so great. So you're gonna tap to it, right? Or catching some people and even like a shoulder lock where their arms above their head like this, right? People are really tight sometimes. So you pulling down up on their arm and blocking their shoulder from their body from rotating back, like that's gonna cause some discomfort and it's gonna get you a tap.
You almost got me on that one.
That
one's a unique one. Yeah, I have a buddy who tapped me with that a while back for the first time, and I'm like, what the heck
was that?
But I didn't like it. And
sometimes you just got to get creative with it, you know. And that's where like knowing the body from personal training and chiropractic and how things move and stuff like that. I'm like, one, it helps me like diagnose someone, but also two, for jiu-jitsu, like it helps me, potentially, tap them or, cause them discomfort.
Yeah.
Right. Yeah.
We have the joke here, right? That you mess them up, but then don't worry.
Don't worry, I got you. I'll fix you, right? So questionable business tactics, but
you always have a job here. As long as you're training at Daruma Dojo and then tweaking people's shoulders.
Yeah.
Don't worry, I can fix that.
Don't worry, I got it. And my thing is, especially here, if I caused it, first time's free.
Yeah.
Because
that's the least you can do.
That's the least I can do. I caused it. I gotta at least give you a free session. And that stands for anybody I roll with.
Man, if I heard that, I would be like, foot lock, or my back.
I know, every time I see Professor G at MILPITAS, he goes, my back. So it's really funny, but it's
anytime you're on the mat and then someone's, I love getting treated by you, and I feel like just even you've been treating me now for the last like 3 years.
3 years at least,
man, your sense of the body is improving, and I feel like we got adjusted last week, and I'm like, man, this Ito's like,
oh, I know,
he got like 2 stripes on his black belt.
Dude,
now.
The last 2 times I've treated you, each time it's right before a kids class, right? And then you come in looking absolutely like stoned just because of just how relaxed you are, and that for me is like a really good compliment. I'm like, dude, I did so good that you're like, oh, dude, like, I just want to go home. I was like, I can't function right now, and this is where like people I call it a chiropractic practice, because I don't know everything. Yeah, if someone claims to know everything, then they're full of something,
Exactly.
I'm constantly learning and evolving, and from day one when I treated you to now, even myself, I've noticed like a night and day difference. Some of the things I couldn't get on you previously, I can get on you now, and I'm like, oh, cool, but it's just a lot of like sense of like feeling like what moves, what doesn't, how can I get it to move, where do I angle you to move it. The really tricky one is ribs. Like you've had a couple rib injuries, I've had a couple rib injuries, and those are hard to deal with sometimes because we got to breathe. And most people breathe through their chest, which causes a lot of discomfort, especially in jiu-jitsu. Well, you put a lot of pressure on the chest. Even laying down, you put a lot of pressure through your ribs, through the back. And some people surprisingly don't know that ribs, they come around the side, like it's a rib cage. So it encompasses from back to front. We just think
ribs in the front, not ribs in the back.
Yeah. So when people say, oh, I have ribs back there, I'm like, yeah, you do. So it's an interesting kind of learning experience with people and whatnot. And even recently, Sensei Sevi, we went to CJ, and he got thrown on his head, neck by a white belt, and really messed up his neck and shoulder. And I did like a spot treatment. Like I wasn't really in a good like energy spot to be able to treat people. So I was like, I'm just gonna try as best as I can. And I actually got some stuff to move that I was like, oh, that was interesting. Just stand you up against the wall. I'm just gonna press on like this first rib up here, and then just really quick hit it with my hand, and it moved it, and it at least like caused them to have a little bit less pain and a little bit less time. Relief. Yeah. It wasn't so severe. Like he still felt it because obviously the traumatic injury of falling on your head, or neck. But at least it wasn't as bad, So those are the nice things. And even here, I'll be like, oh, you landed wrong on your wrist or something happened, like just
let me feel
onwards, And I do that in an A team as well. Someone tweaks something, I'm like, oh, let me check that. Boom, cool, one and done. Like I like doing spot checks. It's easy, it's nice, and it shows like people are like, oh, what he's doing, So, and even I get people to like lately, because I'm still dealing with some shoulder laxity or injuries and stuff like that. So as I work out, I notice like my right, I'm like, dude, struggling to work. But my left, I'm like, hey, I'm lifting all these weights, you know? And I'll be like, hey, can you just like do this shoulder, and I'll show them how to do it. And they're like, yeah, and I pop it back in. I'm like, okay, cool, back to my workout.
Oh, nice.
You know, and it's just a super cool,
Let me know if you ever need me to pop anything back in for you.
Yeah.
It would be my pleasure.
Your pleasure. I know Noah and my joke between Professor Noah and myself is as we roll together, he'll get me in something and I go, oh, something went. He goes, haha, that's $75. You know? So it's a funny like joke between us. So he's like, oh, I felt that go. I'm like, okay, cool. You know? Yeah.
So like, I feel like, I love having you here. And then if somebody ever, I do my best to like, hey, you got, because people do jiu-jitsu, man. We need something to help us.
Yeah.
Like we gotta take care of our bodies. I've been learning, you know, as I'm about to be 40, so I'm not young, but I'm not old.
No,
thank
dude,
you.
Still a young stud.
Yeah, but I'm not 20s anymore. I just started jiu-jitsu when I was 17.
Yeah, definitely.
And then
different.
I can go 100%.
Yeah.
And then like
you bounce back faster.
And now
you heal faster.
I'm like, hey, I have to go. I want to train hard, but I want to be able to train tomorrow.
Yeah.
And so I need to also train soft. So going to you and once a week is part of my routine.
Yeah.
And that helps me a lot. So I know a lot of us here that are in tech jobs or are athletes, and we got to take care of our bodies. So I encourage much as I can for people to do something.
Yeah, something.
And
you know?
and at least come and give you a try, because like you said, like the more you treat the same person, the more you get to know them, and the easier that you can give them relief.
Yeah.
If it's one day, you do your best,
Okay,
but like
yeah.
if it's like, if I saw that person for a year,
then like just see
I know this person.
The difference, you know. Yeah, no, and even if it's just like, you know, people may not jive with me, with my personality and stuff, and that's totally fine. You know, I understand that not everyone's gonna like you,
What's
right?
not to like?
Yeah, you know, no. But like as long as you just get out and be seen by someone, right? Like, you know, acupuncture, massage therapy, other chiropractors, you know, something, a body worker of some sort. Or if you're like, that's not for me, then like get your, you know, checkups, your with your primary care MD, like, you know, regularly, right? Like just something to kind of make sure you're kind of tip-top shape, you know. Maintenance care, something, you know, like whether it's with me or someone else, like, you know, I have a patient that sees me when his chiropractor is out, and then is mainly with his chiropractor. I'm like, that's fine, you know. That's I'm very like honored and happy that you're letting me work on you, right?
But you're his mistress.
Exactly. Yeah, exactly. And it just works out. And I'm currently in transition from one job and focusing more on my chiropractic and personal training career, and some of my patients are even like that too. I have at least a few that are like, hey, can we see you like every once in a while, and like still see, you know, the place I'm leaving, and I'm like 100%, like I'm totally fine with that. Are they fine with the place I'm leaving? They're fine with that. Like maybe not, but you know,
it's not their choice.
It's not their choice. It's the patient's choice ultimately. Yeah. But as a business standpoint, they might not like it. But at least they still have a patient. It just may not be as frequent.
Right.
So I highly suggest, like, you know, going out and working out, moving, right, somehow, right? Whether it be walks, whether it be hikes, whether it be get to the gym or swim or join jiu-jitsu, judo, something, right? Do a hobby, do a sport, and then get care, right? Because like people don't realize that you know, sitting at a desk all day, 8 to 10 hours a day, is really bad for you, you know, but they do it, right? And the amount of like, one, lack of movement, and two, like talk about like posture and tightness in different areas and stuff like that. Like it's a thing, you know. That's why companies have ergonomic assessments, and I highly recommend that even if you don't want to get treated by anybody, at least get your company to give you an ergonomic assessment. And typically, from what I remember, they should be free. You should just go to your IT department, ask for an ergonomic assessment. It may take a while, but at least they can kind of be like, hey, you know, let's work on this situation and make sure you're not hurting yourself. Because the last thing they want to do is pay for a work comp case, you know? So, yeah, but that's an option too.
Good point. So can you tell, I want to finish with this. Can you tell people, like, your business, the name of your practice, where they can find you,
Yeah.
when they want to go and get treated by you, or when they want to do chiropractic treatments, or they want to do personal training with you, how can they do that? How can they reach out to you?
So right now I'm still kind of getting all that kind of wrapped up, right? So my practice is called Kraken Sports Chiropractic and Wellness. I work out of A-Team Health and Fitness Gym, personal training gym. So I'm here currently Monday, Wednesdays, and Fridays, and I'm going to expand to Monday through Saturday. The way to contact me is either my personal cell phone, 408-206-3256. That is the easiest and best way to either call me, text me, to set up an appointment, because right now we are sharing space with me and another chiropractor, so we're trying to make sure the schedule is aligned so we're not double booking over each other. So that's the easiest way, and then further information a bit later, because I'm setting up a website, a email, and getting a work phone. So yeah, that number, 408-206-3256 is my personal. Call me, text me, set something up, even if it's just a consultation. So
can they slide into your DMs or what?
Oh yeah, Instagram at ITON752, and that is ITOEN752 on Instagram. I have a Facebook, but I don't really go on that. But Instagram and text or call is kind of the best way to reach me. So,
and then if they wanted to see you personally, they can just come to Daruma Dojo.
Yeah.
Or they can go to A-Team and just say, hey, where's Ito?
Where's Ito? I'm typically here at Daruma like 4 to 5 days a week, 4-ish days a week. And then I'm at A-Team right now 3, and again, it's going to expand to 6. So, and the nice thing is they were realistically right next to each other, just 1-2 minutes.
If you're not at one, you're probably at the other.
Yeah, exactly.
There's a good chance.
yeah, exactly. And that's why I wanted to kind of stay in Sunnyvale. So like, I'll be at either one. So yeah, come find me and I'll say what's up. So yeah, thank you.
Thanks for the conversation, Ito.
Yeah, I appreciate it.
Hopefully you have time for a chiropractic care.
Oh, of course.
I need an adjustment.
An adjustment? Let's do it. Let's do it.
Thanks.
Take care, everyone.